to Eugene's Speech Language Therapy's weekly videos. My name is Sierra. This week I wanted to talk to you about resonance. This is a topic that can relate to a lot of different people. It can be beneficial for singers, anyone who uses their voice, anyone who has a voice disorder, and people who just maybe don't like their voice or want to change how it sounds. Resonance is something that I teach, I want to say most people that I work with on the voice, because it's such an integral part of our speech output. So quick review for speech mechanics to get us started. Overall, there are 4 systems that create speech, right? So we have first respiration, which comes from your diaphragm and your lungs. It's the energy behind your voice. And then you have the phonation, which is your voice box, the vocal cords vibrating to make sound. And then you have resonance. And resonance is how the sound is shaped, basically, with the cavities in your head. And you have several cavities. You have a pharynx, which is kind of in your throat. You have an oral cavity and a nasal cavity, and these are open spaces of air. The last is articulation, and that's how we shape the sound as it's coming through our mouth to sound like the language that we speak. I have a video on this, speech mechanics, if you want to review that. It's pretty interesting. But for now, we're just going to talk about resonance. So I'm going to give you a quick tip to find good resonance. And this is something that you can do every single day for a few minutes or for a longer practice. You know when you hear someone's voice and it's really pleasing, you really like the way that they sound. They're most likely using their fundamental frequency, the most natural frequency for their body in terms of their voice pitch. They're not speaking too high or too low. And they're probably using great articulation. They're enunciating the sounds. And then they're using good resonance. So in my practice, I'm usually seeing people who have speech disorders, but like I said before, anyone can utilize this practice to improve their voice. Basically, when I use it, my goal is to get the energy off of the vocal cords, the throat, up in front of the speaker. So you want to drive the force up and out. Now I'm going to use a term called masking, and this term is really commonly used in vocal training for singers. So singers will recognize this. I might talk about it a little bit differently than your voice coaches, but that's because I'm a speech pathologist. How I describe masking is, you know, you're speaking or vocalizing in the mask when you can feel vibration in your lips, your nose, and sometimes even up in your forehead. So when someone isn't using good masking, that means they're talking down here. You hear the difference? It's quiet. It kind of can get gravelly, maybe breathy, or it doesn't have a very good sound. So when you are speaking in the mask, you are resonating in the nasal cavity and the oral cavity. So I'll tell you how to get there. First, there are 3 sounds that go only through the nasal cavity. So the air is coming up, all the way up and through the nose. That's M, N, and ng, as in NG, like in sing. When you do that, your soft palate opens up and it allows the air to come out through the nose. That helps you to get into the mask because it's bringing the air up and out. So we start with saying and we touch our nair on the side and we feel the vibration. You can do it for N, and feel the vibration. Once you have that done really well, you have a nice, smooth, easy vocalization and you feel good vibration. Feel it in your lips too. Then we move on to a consonant vowel like ma. And what I teach people to do is to try their hardest to extend the feeling of being up and out with the resonance through the vowel. This is not doing that. Ma or ma. Now I want you to go ma. Hear the difference? You can feel it coming up through the nose and the mouth. Now in speech therapy, we do a hierarchy, and so we go from one sound to a consonant vowel, and then to words and phrases and sentences, and we move on to conversation. I will put a list or a link in the comments for some M words for you to practice with. Another tip to help with good resonance is to have good breath support. So you can't resonate if you don't have adequate breath support and voicing. So work on taking really good breaths in where the torso comes out, exhaling and the torso comes in. So right? So you push from here when you're speaking. So the first step is a good breath. And then you can say your M words. Mom. I can feel my nose vibrating when I say that, and you can hear it. Another good tip to help with this is to open up your mouth. For some reason, some people think they can talk like this and sound okay. You want to help to get this sound up and forward, right? So you can even move your jaw forward a little bit. Mom. You see that? Open up your mouth. It's going to help you to project and be louder without having to push as hard, okay? Mom, right? As opposed to mom. So practice with those strategies, trying to get into the mask, really trying to feel the vibration in your mouth and your nose, getting the strain off of your throat. It's going to help prolong your voice. It's going to help keep a healthier voice and a more pleasant sounding voice. I hope this is beneficial for you. Please subscribe, like, and comment. I put out a video every week on speech therapy topics. I hope it helps. Have a great day.